Would love to welcome you to tonight's session. My name is Mary Ann Duddyberg, and I serve as Dignity USA's Executive Director. We are very happy to welcome you tonight, and we thank you for joining us for this very important and unfortunately timely conversation about conversion therapy, or practices that try to help people change their sexual orientation or gender identity. As many of you know, this practice has been much in the news again lately due to the recent Supreme Court decision in Childs versus Salazar, in which a Colorado therapist was found to have had her free speech rights violated by Colorado's ban on the practice of conversion therapy for minors. This practice has been a concern for Dignity and our communities and our members for a very, very long time. We have many members in our communities who have gone through this process, either in an attempt to change themselves at a time or from a culture where who they knew themselves to be was not valued or was thought to be evil or sick, or they were either coerced or forced into conversion therapies. We have lost members as a result of the impact of these practices in our communities. Dignity USA was one of a number of faith groups that were in the forefront of helping California pass the first conversion therapy ban back in 2001. And we have worked on almost every other one of the 21 states and District of Columbia that have subsequently passed similar bans, either from the national level or through our local chapters or both. We also felt it was important to have materials against conversion therapy practices from a Catholic perspective. So with the help of the Alana Chen Foundation and some of the folks who are on this session tonight, we published this book, Made in the Image of God, a Catholic publication that talks about the problems with conversion therapies and has testimonies of supporters. And this book is available both in hard copy and as a download from our website. So if you haven't already seen it, I urge you to check that out. And finally, just one final example of our involvement. We did have an amicus brief in the Childs versus Salazar case on the side of supporting Colorado. Both Dignity USA and Dignity Denver were partners in that case, and unfortunately, it didn't turn out our way. So that's just a little bit of the context and history of Dignity USA's involvement in this case. And tonight we are also very gifted to have with us a member of our community, a longtime member and leader in our community, Joe Gentilini of Columbus, Ohio, who has often shared his story of his 9-year journey through conversion therapies, and is willing to tell us a little bit of his story. So Joe, welcome, and thank you very much for speaking with us tonight.
Thank you,
Joe.
Mary Ann.
Okay.
I'm going to read it for time purpose. I was in some form of conversion therapy from 1959 until 1974. I was shamed about my sexuality early in my life. In 1959, when I was in 7th grade, I first mentioned that I thought I was homosexual to a Catholic priest. He advised me to learn to play baseball and to work out with the Royal Canadian Air Force exercises. It didn't work. I still felt gay, and I felt like a failure in not being attracted to women. When I entered college in 1966, I still had strong same-sex attractions, and one day I went to confession because I felt guilty masturbating. The priest told me I was seriously mentally ill and told me to see the school guidance counselor, which I did. The guidance counselor, Mr. Paul, told me that whenever I masturbated, I was to come in and tell him that I had violated my vocation to love, which I did for over a year. I told him that I thought I was gay, but he denied it because I had not had any overt behaviors, but I knew what I felt. He encouraged me to go to dances and to date girls, which I did, but I still felt attraction to men. I believe there was something fundamentally defective about me, and I was shamed. In about a year and a half or two after that, I had my first homosexual experience, which frightened me. I decided to see a counseling psychologist who said that I could become heterosexual because I only had had one homosexual experience. For months, I was prescribed medication, which made me feel like a zombie and which prevented me from having a physical ejaculation. I did everything the psychologist recommended, but it didn't change my feelings. He said that my homosexuality was only a symptom of my feeling inadequate as a man. Over many years, I was trained to put a finger down my throat if I thought of oral sex. I was told to buy a female blow-up doll and make love to it. If I thought of a homosexual fantasy, I had a rubber band on my wrist and I snapped it, causing me mild pain. I was even directed to think of a male fantasy, feel the need for sexual release, and then right before the orgasm, look at a picture of a naked woman or fantasize about having sex with a woman. What happened was that the orgasm occurred, but I felt as if a metal plate had been thrust through my waist, and I felt nothing. I dated women, but it didn't do anything for me sexually. Total frustration. Throughout those many years, I did date women, but never felt heterosexual. After going to a movie once and getting something to eat, my date then took me back to her apartment, went into her bedroom and came out totally naked. She told me I could do anything I wanted with her. I felt terrible because I just wasn't attracted. I went to prostitutes with the direction of the psychologist in order to have a heterosexual experience. The psychologist thought this was wonderful and increased my chances of becoming heterosexual, but it didn't change anything in my orientation. Once again, I felt guilty and shamed. I spent years thinking that I really was heterosexual in orientation, but I hadn't found it yet. The doctor told me that I would never feel 100% heterosexual, but that it would come in degrees, partially homosexual, partially heterosexual. That wasn't good enough for me. I felt like I was fundamentally defective as a person. I had been suicidal for many years, and every night when I went to bed, I would tell myself, if it got too bad, I can always kill myself. There were two occasions when I believed I would have killed myself if I had had the means to do so readily. After being in conversion therapy for those many years, I once told the psychologist I couldn't continue therapy because it wasn't working. He said that he thought I was more heterosexual than I was before, and I countered that I didn't feel any less homosexual. It was only then that the psychologist, years later, asked me if I wanted to have another homosexual experience to see if I would react the same way. I did, and I felt congruent. At the same time, I didn't want to be gay. I spent the next 6 months trying to decide if I wanted to try conversion therapy again. An article in the National Catholic Reporter by a Catholic theologian and therapist on the church and the homosexual gave me hope that I could be Catholic and a happy gay person. I attended a conference on the gay Christian in 1974. At that conference, I had sex with a gay man to whom I was really attracted. I decided that I truly was a gay man, and it was possible to be happy and at peace. It took me months, however, before I could even say the words, "I'm gay and it's okay." I was shamed, not only for being a sexual being, but also because I was homosexual. My mother says she was sorry she had gotten pregnant with me and that I was a rattlesnake around her neck. It was pure hell. 13 years later, she reconciled with me. I am now happy with my husband of 45 years this coming November, and my story is contained in my book, Hounded by God, A Gay Man's Journey to Self-Acceptance, Love, and Relationship. The end.
Thank you so much for sharing your story with us, Joe. We know that there are many who can relate, and we're so glad that you've experienced enough healing to be able to talk about what happened and to be a voice for those who may not be able to speak for themselves. We're grateful to be able to continue to share the stories of conversion therapy survivors with our community. Our next speaker is Lucas Wilson. Dr. Lucas Wilson is a Social Sciences and Humanities Research Council postdoctoral fellow at the University of Toronto, Mississauga, and was formerly the Justice, Equity, and Transformation postdoctoral fellow at University of Calgary. A current Humanist Thought Fellow through the American Humanist Association, Lucas is the editor of Shame, Sex, Attraction: Survivor Stories of Conversion Therapy. He is also the author of At Home with the Holocaust, Post-Memory, Domestic Space, and Second-Generation Holocaust Literature, which received the Jordan Schnitzer First Book Publication Award. His public-facing writing has appeared in The Advocate, Queerty, LGBTQ Nation, and Religion Dispatches, among others. He is currently working on two new anthologies, Don't Ask, Tell All, Stories of Christian Colleges' Anti-Queer Regimes, and Queer and Trembling: Stories of LGBTQ plus Religious Trauma. Lucas, we are grateful to have you. I'm going to go ahead and turn the spotlight over to you, and you can get started whenever you're ready.
Beautiful. Thank you so much. Thank you, Marianne. Thank you, Darby, for having me. Joe, thank you for sharing your story. I'm super grateful to be here and to be sharing with everyone tonight. So whenever I offer a talk on conversion therapy, I always think it's important to offer working vocabularies, right? So the vocabularies that conversion therapists use, and also the vocabulary that conversion or those who are against conversion therapy use, right? So activists and academics and survivors and allies. And of course, these two different, lists of vocabulary or vocabularies are quite different, and for good reason. So conversion practitioners or conversion therapists, they know the optics of the term conversion therapy, right? They know that the general population has an understanding of what exactly conversion therapy is, and therefore they know that it's not a cute look to use the term. So instead of using the term conversion therapy, oftentimes nowadays, they'll opt for different language. And in the past, there were other terms that were in vogue from the 90s onwards, like reparative therapy and change therapy. But even those terms are quite recognizable. And so conversion practitioners will oftentimes use different terms. They'll use euphemistic language to mask or to cover over the dirty work that they do, because again, most people know the terms conversion therapy, reparative therapy, or change therapy. So in counseling or clinical contexts, the language that conversion practitioners will use include terms like reintegrative therapy, desistance therapy, reorientation therapy, and gender exploration therapy. And these are terms that have a valence of credibility, right? They seem almost respectable or, legitimate terms. But the moment you do the quickest Google search, you'll see that these are synonymous with conversion therapy. But again, they'll oftentimes use this language to really obfuscate the work that they're doing. Now, I should say that, again, these are the terms that are used typically in clinical or counseling settings. Conversion practices, however, occur disproportionately in high control religious contexts, more particularly in high control Christian contexts, both Catholic and Protestant. And so because of this, the language again shifts a wee bit from these terms that again are out of vogue, like conversion therapy, reparative therapy, or change therapy. And so instead, conversion practitioners are going to use other terms to again cover over, hide the work that they're doing, while still nonetheless practicing definitional conversion therapy. And so the terms that conversion practitioners in religious contexts, those who are pastors or lay, church leaders, they're going to use one of three terms typically. Not always, this is not an exhaustive list, but this is, the language that's typically used. And so the terms that they're going to use include biblical counseling, biblical worldview counseling, and pastoral counseling in conjunction with gender and or sexuality. Of course, not all biblical counseling or pastoral counseling is conversion therapy, by no means. However, When you see these terms like pastoral counseling, which is probably the most common, with or tagged on, or with the words gender or sexuality tagged on, 9 times out of 10, if not 10 times out of 10, we're talking about conversion therapy. So if you look on a church website, you look on a ministry's website, you look on, another organization, nonprofit website, and you see these terms, pastoral counseling for those who are confused about their gender or sexuality, those who want to explore their gender or sexuality. Again, these are dog whistles for conversion therapy. Now, that's the language that conversion practitioners or conversion therapists use, or supporters of these practices. As for those of us who are against conversion therapy, right? So those who are in academia, those who are, progressive clergy, those of us who are survivors or allies, again, the language shifts, and we, of course, use different language. I will say that the vast majority of us do use the term conversion therapy largely because this is the most recognizable or intelligible term that's out there, right? When people hear the term conversion therapy, they're like, oh, I know what that is. Again, at least in a general sense. And so we oftentimes will use the term conversion therapy to meet people where they're at. And you'll hear the term conversion therapy, you'll hear the term conversion efforts, you'll hear the term conversion practices. These are all really just naming the same thing, just again, using a few different words. But understandably, there are a lot of folks who have a really strong aversion to the term conversion therapy. The word conversion has a lot of baggage, right? And so people don't feel necessarily comfortable to use this term. So instead, they're going to opt for, typically, not always again, but typically they're going to use the term SOGIES. And SOGIES stands for sexual orientation and gender identity and expression change efforts, which is quite a mouthful. And so they'll opt for, again, instead, SOGIES or just change efforts. These are typically, again, the terms that are more in vogue nowadays. But again, a lot of us who are in these spaces who talk about conversion therapy and fight against these practices, we use a lot of them interchangeably. I will use them interchangeably throughout tonight's session, but I do encourage you to use whatever you feel most comfortable with. If in fact you don't necessarily like the term conversion therapy, change efforts works, SOGIES works. So I think I'm preaching to the choir in a lot of senses, and in that I think most people in here know what conversion therapy is, just like, again, the general population. But just to make sure we're all on the same page, I'm going to offer a quick working definition and then go into some details. So the definition of conversion therapy at its core is these are efforts to change an individual's sexual orientation, gender identity, and or gender expression. Right? These are efforts to repair or to reduce or to suppress non-normative genders and or sexualities in favor of heterosexuality and or heteronormativity, right? It's really to change an individual from who they are into who they're not in terms of their gender and or sexuality. And all conversion practices are undergirded by what academics and activists refer to as conversion ideology. And conversion ideology really is just pejorative beliefs and teachings that frame queerness as incomplete, as broken, as sick, as sinful, as degenerate. Insert your negative adjective here, right? It's really the belief that queerness needs to be changed, queerness needs to be cured, queerness needs to be fixed. And so conversion practitioners believe that there's either a source or a number of sources that cause folks to become queer. And I'm going to offer again a quick list. This is by no means definitive, but nonetheless, it does give a pretty a good idea as to what conversion therapists believe to be the cause for why queers are queer. And so some of these causes include damaged or inadequate relationships with one's parents, or just parent, right? So the overbearing mother narrative that a young boy is gay because his mom was overbearing, or his dad was an absentee father, or emotionally distant or abusive. Very much this pseudo-Freudian understanding of human sexuality that conversion practitioners employ. So in addition to the damaged or inadequate relationship with one's parents, this is oftentimes, there's also the belief that there's damaged or inadequate relationships with other folks, whether it be folks' siblings or figures of authority, especially when a child is growing up and the child is identified as queer. They believe that, again, it's someone, a figure of authority being a bad influence. There's also the belief that pornography causes queerness. There's the belief that negative experiences with the quote unquote opposite sex cause queerness, right? That, a guy asks a gal out and multiple times he gets rejected. And so then, he's like, well, plan B, I'm going to go for, for men. This is legitimately a belief or a theory for why folks are queer. There's also the belief that negative spiritual influences, i.e. demonic possession, results in queerness or can result in queerness. And then there's also the belief that there can be a predatory member of the same sex for a person becoming queer. So, a lesbian gym teacher preys upon Sally and boom, she's a lesbian. This is, unfortunately, as silly as it sounds, this is actually how some of these folks think. And so in order to address these sources or causes, conversion practitioners employ a number of practices to cure people, to fix people, to change people. And so I would say the most common practice at this point really is talk therapy. And therapy is in quotation marks, right? There's no therapy involved here, and folks should not have to go to actual therapy after going to quote unquote therapy, but I digress. So talk therapy, again, this pseudo-Freudian approach to human sexuality is typically it's mainly how conversion practitioners operate. This is oftentimes done in conjunction with behavioral modification, right? So to change how someone acts so that over time they're not just acting like a real man or acting like a real woman, but that they're going to not just, again, act like a real man or a real woman, they're going to become a real man or a real woman, again, all in quotation marks, but at a certain point when I put quotes around everything, they kind of lose their meaning. Anyway, that really, it's this belief that it's sort of fake it till you make it, right? To perform and affect a brand of masculinity or perform and affect a brand of femininity so as to habituate that gender identity and then that gender expression, and then ultimately that gender identity will change. And then in turn, according to conversion practitioners, one's sexuality will change as well because of this gendered performance. So this is, again, a really common practice that's employed, this behavioral modification, and in some cases suppression, done in concert with typically talk therapy counseling. Other conversion practices include aversion therapy, right? So I think the most commonly known form of aversion therapy would be electroshock therapy. Joe referenced before the elastic band method. This is also a form of aversion therapy that conversion practitioners push. There's support groups, there are camps, there are inpatient and outpatient programs. I would argue that transphobic healthcare practices fall under the rubric of conversion therapy. We can talk more about that later and break that down, but I would argue that this is in fact a conversion practice. Corrective prayer as a conversion practice, right? So to lay hands on folks and to pray for them so as to change them. This is quite a common practice as well. Also forced celibacy, right? So pushing folks to remain chaste so as to change their desires over time. There's also coerced sexual relationships, right? So pushing folks into mixed orientation relationships, specifically marriages, so that, a person over time will fall in love and find attraction to his or her or their spouse. As a form of conversion therapy. There's also coerced sexual relations, i.e. forced rape, as a form of conversion therapy. And there's also exorcisms, right? So trying to exorcise demons from folks' bodies so as to change them. So these are the most common, but again, certainly not an exhaustive list of conversion practices that are all undergirded by conversion ideology, really in an effort to change people into, to align them with the heteronormative model. Now, there are, of course, numerous consequences, documented consequences of conversion therapy. And there's a lot of research to back this up. So it's not just that conversion therapy doesn't work, but it's that it's wildly harmful for a multitude of reasons. And so some of these consequences are psychological, some are social, some are spiritual, in some cases, some are physical. The number one cited consequence of conversion therapy by conversion therapy survivors in a recent Canadian study was shame, right? And I don't think there's a lot of sort of surprise there. We can talk more about shame and we can talk more about these consequences, but that is the number one cited consequence for undergoing conversion practices. Other consequences, other psychological and social consequences include guilt, anxiety, difficulty celebrating queer and trans identities, depression, difficulty in romantic and or sexual relationships, isolation, poor self-esteem, anger, disruption in family relationships, and suicidal ideation. but not just suicidal ideation. According to research, that folks who undergo conversion therapy experience lifetime suicidal ideation. And the chances actually double for folks who undergo conversion therapy. So these are, again, some of the psychological and social. Other psychological and social consequences include greater dependence on drugs and alcohol, increased chances of experiencing homelessness, negative impacts on identity formation, and overall just poorer mental health. As for spiritual consequences, it's great when I get to talk to faith-based organizations because I don't have to offer why I'm talking about this or almost like justify why I'm talking about spiritual consequences. A lot of people think like, why are we even talking about these things? But what I do say to those audiences is, I mean, a lot of the folks who are undergoing conversion therapy, again, the vast, vast, vast majority of folks who undergo conversion therapy are coming from high control religious contexts. And so just because you take someone out of conversion therapy doesn't mean that they then therefore forfeit their relationship to God or the divine or, a higher power. These are folks who still have religious commitments and in some cases are even still in their religious communities. And so I think it's very important that we do talk about spiritual consequences after undergoing conversion therapy. So some of these consequences include a negative impact on one's spiritual self-identity, how someone sees oneself as a spiritual being. There's also a negative impact on folks' ability to construct existential meaning as a consequence. There's also a negative impact on folks' ability to connect to God or the divine. And then on top of that, especially if folks went through conversion therapy in religious contexts, there's a negative impact on those folks' relationships to their religious communities. As for physical consequences, if we are thinking about aversion therapy, I think it's kind of obvious what the physical consequences are. But there are other physical consequences, including various psychosomatic impacts on folks. And so we can talk more about that after, but that certainly is something to talk about as well. I think it's also important to talk about the prevalence of conversion therapy in specifically the US. I'm in Canada, the stats are different, the laws are different, but in the US, the most recent study we have, which is at this point a little bit outdated, it's a few years old, but that study, which is coming out of UCLA, out of the Williams Institute there, that study suggests that approximately 700,000 adults in the US have undergone conversion practices. And this is about 7% of LGBTQ communities within the US. But whenever I offer this statistic, I always think it's important to think about this stat critically. Not because I'm not thankful for the research. I'm wildly thankful for this research. Again, it's probably the most cited study on conversion therapy when we are talking about prevalence. But I think that there are problems no matter what with studies on conversion therapy. And the main problem is the issue of self-reporting. And under the umbrella of self-reporting, there are two main problems, and I want to go over both of them just to, again, really emphasize that I really do think that the number of 700,000 is actually quite low in comparison to what the actual numbers probably are. So the first problem with self-reporting is that a lot of folks who undergo conversion therapy don't understand their experience after the fact or during as conversion therapy. I can use myself as an example. I went to Liberty University, which is Jerry Falwell's school. Those who know who Jerry Falwell is, you know what kind of school this is and know what Liberty is. Those who don't know who Jerry Falwell is, count your blessings. But I went to Jerry Falwell's school. I went to Liberty in Lynchburg, Virginia, and it was there that I underwent 4 years of conversion therapy. However, I did not conceptualize my experience at Liberty with this pastor. His name was Pastor Dane Emmerich. I didn't think of my experience with this pastor as conversion therapy. I thought of it as pastoral counseling. I thought that this man was trying to help me overcome my quote unquote same-sex attractions. And it wasn't until I went to grad school, I eventually, left Liberty and I went up to a school in Ontario where I live. And it was there that I was in my office with one of my office mates and we were chatting about our undergrads. And I think most folks thought I was an alien. They were like, who the heck is this guy, who comes from Liberty University, and they were asking me, what was your time there like? So I was chatting with my office mate and she was telling me about her experience. I was telling about mine. At the end of it, she says to me, oh, after I explained to her, my meetings with the pastor, she said, so you went through conversion therapy. And I was like, nah, I don't think so. And at that point, of course, I knew I'd heard of conversion therapy, right? But I not once connected my experience with conversion therapy. It just was not how I framed my lived experience. I just thought of it as, again, pastoral counseling. And so a lot of folks who are participating in studies about conversion therapy, when they're filling out questionnaires, when they're answering surveys, and the question comes up, have you undergone conversion therapy? Not most of the time, a number, it's not uncommon that a lot of folks are going to answer, no, I didn't go through conversion therapy. Meanwhile, their experiences constitute definitional conversion therapy. So that's the first issue with self-reporting. So that's why we're not going to have necessarily the most accurate numbers for one reason. The other reason is, like I said before, that the vast, vast, vast majority of conversion practices are happening in high control Christian contexts. With that being the case, a lot of folks who undergo conversion therapy and or are continuing to undergo conversion therapy, they remain within these communities, right? So they are going to stay within these Catholic traditions, these Protestant traditions, right? They're going to stay within these communities, and they're not going to leave, and they're also not going to participate in studies about conversion therapy. Wait, we're talking about folks who are highly skeptical of research. They're highly skeptical of higher education when it's not coming from a Christian institution, right? It's seen as the godless academy, right? They're not necessarily all that in favor or trusting of medicine, public health. We can think back to COVID-19 when masks became a political issue. We can think about anti-vaxxers. Where do a number of these folks come from? High control religious communities. These are not folks who are interested in evidence-based claims in academia, in medicine, in public health. They are, again, highly skeptical. And so when someone comes along and says, hey, do you want to participate in a queer study? What do you think they're going to say? No, right? This is, of course, a major issue because, again, the vast majority of these practices are happening in these spaces. So that means then the vast majority of survivors are either coming from these spaces or still in these spaces. And so for those who are still remaining within the fold, they're not going to participate in these studies, which of course is going to impact the numbers that we have. So again, I'm super thankful for the 700,000 number that we have. It's just not the whole picture. Again, it's a good place to start, but it's certainly not where we can end. So that's, again, to give a little bit of an idea about prevalence in conversion practices prevalence in the US right now. Of course, there was a recent Supreme Court decision that I think a lot of folks are aware of, and we're going to break that down a little bit. So Childs versus Salazar, this was a case brought out of the state of Colorado, and it eventually made its way to the Supreme Court. We're actually talking about someone who never practiced conversion therapy. This was someone who was used as a pawn by the Alliance Defending Freedom, the ADF. She never, again, she was just sort of chosen and has become the poster child for this movement at this point, but again, has no experience in this arena. And so what happened was Kaylee Childs, who was represented by the ADF, the Alliance Defending Freedom, an ultra conservative alt-right organization that is very powerful, very well funded, and very well resourced and connected. This organization argued that her free speech was being infringed upon by her not being allowed under state law to practice conversion therapy. Which I should say parenthetically is an absolutely bonkers claim, right? It's this really, really silly argument. However, of course, as we all know, spoiler alert, she was successful in this case. When I think about the merits of this case, right? This idea that her free speech was being infringed upon, it's just bananas. Because when you think about this, every single professional who has a code of conduct, and most professions have a code of conduct, whether you're in medicine, whether you're an engineer, if you're in counseling, whatever, you have a code of conduct that you must abide by. And when you are on the clock, when you are working, your ability to say whatever you want is superseded by, eclipsed by the code of conduct, right? If you're a doctor, you can't just go into your office and talk to patients and express your racist beliefs. You might be racist, but it doesn't mean that you're allowed to do that on the clock. Why? Because there's a code of conduct, right? In the same way, you can't just say and do whatever you want when you're a counselor, when you're a clinician. However, this was the argument, and this was a successful argument, at least in the eyes of the Supreme Court. So she challenged the law, but I should say, and there's a lot of misinformation and in some cases disinformation about this Supreme Court case. The state ban has not been struck down. A lot of folks believe that in the state of Colorado right now, anyone who is a licensed practitioner can practice conversion therapy on a minor. That's simply inaccurate, and that is not the case. When Kaylee Childs presented a challenge to the state law, she presented an as-applied challenge, which is in contradistinction to a facial challenge. And the difference between these two, an as-applied challenge and a facial challenge, is that an as-applied challenge to whatever law or ban or whatever you're challenging, that means that whatever decision the court makes is only going to apply to you. So in the state of Colorado today, the only person who is a licensed practitioner who can practice conversion therapy on minors, even though she has never done this, is Kaylee Childs, right? Versus had she challenged the law with a facial challenge, to challenge the face of the law, that would have meant that if she had been successful in that in the lawsuit, that every single licensed practitioner would be able to practice conversion therapy on minors in clinical contexts. That wasn't the case. She did not challenge the law in this way. She challenged it as an as-applied challenge. So today, there is only one person in that state who can practice conversion therapy in clinical contexts. Very important to talk about because, and this is where the misinformation and disinformation comes in. I think organizations like the ADF, like the Family Research Council, like different universities that practice conversion therapy and beyond, and also nonprofits and counseling organizations, again mostly high control Christian organizations, that these organizations want us to believe that the fight is over. They want us to think that we've lost. However, that Supreme Court case is still live. Yes, there was a decision made, but that case was sent to the 10th Circuit for review, right? And so that the 10th Circuit will make a decision and we'll go from there. But for right now, the merits are still live, right? We are still fighting this. This is not done and over with. And so I think for a lot of folks who are pushing this narrative that conversion therapy has been, legalized in the state of Colorado again, and the ban has been struck down, it's not true. And I think they want us to think that so that we stop fighting. But of course, what we need to do is to continue to fight. I think I might be at time. Marianne, I don't want to go over time. And so I'm going to stop there and open the floor to questions.
This is great, Lucas. I really appreciate that. And I'd actually like to push a little bit farther on this, what has happened with Childs v. Salazar, because I think it is not just the right-wing groups who are pushing this narrative. I mean, every headline about this was, the media played into their narrative about this as well. So I think, it's not surprising in some ways that people believe, and that now all of these efforts are happening at the state level or county levels or, in legislative bodies, city bodies, to overturn this on the basis of the Supreme Court decision. So, I mean, the distinction is not one I think people are very familiar with. And, I don't even know how practical it is to try to counter that narrative with this sort of tidal wave of disinformation out there.
Yeah. And you know what, Marianne, and it's not even just the media outlets. It's also queer influencers. I saw a number of queer influencers on, different social media, Facebook, Instagram, and whatnot, pushing this narrative where it was explicitly Colorado's banning conversion therapy has been struck down. And I'm sitting there thinking, what in the world? And obviously what they're doing is clickbait, right? They're getting people to click and comment and like so that they get money based on that. That's why they're doing it. But this is what's sort of a scandal that it's, again, like you said, it's media outlets as well as even people who are a part of this community or these communities are pushing this forward.
Yeah. And even some of the, I think, more respected legal analysts didn't really help folks in understanding this. So, but I think it's a really important narrative that we all have to be doing more. But, again, given that this has been seen as a major sort of cultural moment, right, and sort of seems to be opening the door again for people who want to engage in these kind of practices, who think that their, religious duty or their clinical duty is to change people who identify as queer in some ways, whether it's on the basis of gender identity or sexual orientation, that there's more license for this. Now, it feels like a very dangerous moment in our community. And again, a time for us to kind of start again on this fight that has been going on so long. So, I mean, who's leading that effort at this point? How can we all best get engaged? And while we're talking about that, folks, please do be preparing questions. Either put them in the chat or use the react button to raise your hand, and we'll open it up for conversation with Lucas or with others. So we'll take that. And then I see already we have a hand up. So go ahead, Lucas. How can we start stemming the tide here?
You know what? I think language matters. Pardon me. I shouldn't say I think. Let me rephrase that. Language matters so much. And the way that we talk about conversion therapy needs to be, we need to use proper vocabulary to describe and name these practices. And according to all research, anyone who's in the academy who researches conversion therapy understands conversion practices as definitional abuse. So when people say, oh, shouldn't a parent have the right to choose conversion therapy for their kids? Shouldn't an adult have the right to choose conversion therapy for him or her or themselves? That's a crazy question when you think about it. These are people asking, should people be able to consent to abuse? We would never say in any other context, oh yeah, people should have the right, they should be able to elect to choose and consent to abuse. But the moment it's about queer folks, whether it be gender or sexual minorities, oh, well, of course that's okay, right? Because we are obviously devalued and not seen as the same as straight folks. And that's where this, comes from and why people are okay with conversion therapy. They wouldn't be okay if this was happening to straight folks, but we're not out there pushing an agenda. Anyway, I digress. I'll get off my soapbox preaching. But, right, it's this idea that we need to frame it as abuse. Why? Because it is abuse. And we need to name it and claim it. Not name it and claim it. We're just going to name it. I'm getting into my evangelical roots. Pardon me. Right? We need to name it for what it is. And according to the UN Rapporteur on Torture, in certain cases, not all, but in certain cases, conversion practices constitute torture. What does it mean folks should be able to consent to abuse? What does it mean that folks should be able to consent to torture? We need to use this language that, again, is appropriate, is applicable, is apt to name what we're talking about. And then, again, turn the question on folks. You think that people should have the choice or the ability to choose torture or abuse? Again, just when you frame it that way, all of a sudden people are like, oh yeah, maybe that is a really ridiculous question I just asked. Yeah, why? Because it is. Like, how else to frame that or understand those questions?
Yeah, speak truth to power. Absolutely. Yeah. I see a hand up saying Melly. I don't know if it's Melly or Carly, but the floor is yours. Hopefully everybody can now unmute themselves if you want to speak.
Carly, but Melly is also here. Hi, Lucas. It's really nice to meet you. Thank you so much for speaking with us tonight. And thank you especially for what you just explained, because to be honest, I mean, so I have worked in politics for years, and I like to think I'm like very, above average sort of educated and following the Supreme Court. And even I didn't know the difference in that case. So I'm like happy to hear that it's just one woman who can practice conversion therapy. But I think, what are your thoughts? I guess I have sort of two questions, or it's like a two-part question. So, I mean, for me, and as someone who, sort of works in professional communications, the thing that really stuck out to me, and you touched on it a little bit, was like the idea that a therapeutic modality can be considered free speech, or like viewpoint discrimination is just like bonkers on its face. Like, just because like this is a form of healthcare, just because it's happening through talking does not mean that it's not a therapeutic modality the same way like as physical therapy, right? Or occupational therapy, or any other number of things that people would obviously be required to like abide by the ethics of their professional organization and applicable state law. So I think I mean, do you think that as this moves through, that like, is that the right sort of frame of like, listen, this is not free speech. This is healthcare. This is like a therapeutic modality. Like if you say if if you say this is free speech, then you're walking us down the road where a psychiatrist could tell their suicidal patients to kill themselves and then be like, well, I have the right to free speech, you know? And then two, you know, something that I think is challenging for us, like as LGBTQ people who still engage with our faiths, is that like a lot of our siblings in our community, and for very understandable reasons, are like very, you know, anti-religion, which I do not blame them for at all. But I think that it can hamper us sometimes because I feel like we have to be able to convince people who are ideologically different from us, listen, and just to use an example, there's a therapist that I like to follow on YouTube. He's a Mormon, but he's like very open and affirming. And when you go to his therapy page in his private practice, he talks about how he was like, I do not do conversion therapy. If I cannot make you straight if you're gay, or, you know, cis if you're trans. However, if you want to work together to figure out how to live within your understanding of your faith, and if that includes celibacy, like we can do that in an ethical way, but I am not going to, but it's going to be about choices that you make, not like that I can change who you are, because I can't, right? And so I just wonder, like, you know, I don't agree that people should be celibate because they are Christian, but like I respect that some people want to live that way. And so I just wonder your thoughts about how to kind of like navigate these different like rhetorical traps that I think sometimes we can fall into. Sorry, that was very long. I appreciate
No, I
it.
love it. So when I'm thinking about your second question, I mean, within Christian spaces, I'm not as familiar with Catholic spaces as I am Protestant. But what I will say is that the name that's oftentimes used for folks who believe that they shouldn't be practicing or acting on their queerness, these are called side B Christians. These are people who function in a certain way where they again live like chaste lives. They live celibate lives. And I think there's a big difference between if you so choose that you want to be celibate. I mean, it's not a life for me. It's not a life I would ever choose. But if that's what you want, okay. And that's what you have come to that conclusion on your own. That's its own thing. Do I think that you should probably interrogate that? Yeah. Do I think you should probably figure out why you believe that? Yeah. But if that's what you, independent of anyone, have chosen, okay, that's very different than someone saying you have to live a celibate life, right? And I think that's the violence. That's the issue. And that's what we see as a conversion practice when someone's telling someone else, you need to live like this, you need to follow these rules, and you need to, again, withhold sex from yourself and, I guess others as well. And so I think that's the distinction I would make. So again, if there's a therapist out there who's saying like, you want this, okay, let me support you. That's one thing. I still don't really, for me, it's like it makes logical sense in the sense of like, I can intellectually understand it, but it doesn't make a heart sense. Like, it's like, why in the world would that be your choice? But I think that like a good therapist would also not just say, let me support you in that, but also, again, let's think through where is this desire, quote unquote, coming from? Why are you saying that you want to live a chaste or celibate life? I think a good therapist asks questions, right? That's kind of the modality. That's kind of the job that these folks have, is to ask questions so as to bring about more self-understanding and awareness, and to work through a lot of, trauma baggage and whatnot. So I think that this therapist, again, if he's supporting these folks, okay, sure, if that's what they want. But again, I think also what would come part and parcel with that is the requirement to have these folks again articulate and to think through why they are choosing this for themselves. And if they come to the conclusion that this is just what they want, okay. But I do think there's a genealogy behind that. There's a reason behind that. There's a history behind that for why they're electing to live a chaste life. That's what I would say about that. As for the first question, I don't know if I remember it, and please forgive me for asking you to repeat it if I don't, if you would be so kind.
Shoot.
Or maybe not.
Yeah. So I guess the question is, what I think what I have found is I feel like since we won marriage equality, we've really been on the back foot of other like both like politically and activism wise, but even just from a communications and like messaging and rhetorical perspective, we've just like really been on the back foot. And I feel like, like my sort of gut and communications experience says like we should be talking about like, this is not a free speech issue. This is not free speech. This is healthcare. And it's not governed by the First Amendment. But what is your sense of like the right way to kind of talk about this issue in a broader like, political, I guess?
Yeah. I mean, the right wing, they perform a lot of rhetorical gymnastics, right? They are quite good at it too. And they find legal ways of doing this. And of course, this is sort of, exhibit A. And so I think that when we're thinking about this idea of, again, free speech, it's just nonsensical if you applied it to honestly any other context, but not just any other context, but this context, I think, is the most nonsensical within a therapeutic, context. This is something that, these are folks who have, through their words, the ability to really bring a lot of life-giving, sort of like improvements to people's lives or a lot of death-dealing consequences. And within therapy, within counseling, within these clinical contexts, their language does matter. Like you offered the example, if someone said, well, why don't you just go kill yourself? I mean, yeah, what would be the response to that? Like, obviously, these words have power. Obviously, this person is in a position of authority. And oftentimes, folks are pushed to have a certain level of deference and respect for these people as figures of authority. Therefore, again, it does not compute for me. And when I heard that this was how the Supreme Court case was going to be argued, I mean, I knew that it was likely not going to be a favorable outcome given the way that the Supreme Court is stacked. However, I thought this argument is just bananas. Like, there's no way, and here we are. So, I mean, I don't know if that answered your question, but I just think to myself, like, it's as crazy as it sounds, and here we are.
So we have a question in the chat. Did you want to read that, Marianne? I'm sorry.
Oh, go ahead, Darby.
I kind of took over. I apologize. So who else is working on this issue and how can we help? Are there other progressive groups working on this? I think the answer to that is probably yes. And I want to know, like, I guess, along with that question that this person asked, like, what have you seen working, helping, and that sort of thing?
Mm-hmm. Yeah, there are a few organizations that are, if you look on the government's website for who is filing amicus briefs, right? These are typically going to be the ones, and you'll see both sides. You'll see those who are advocating for conversion therapy, those who are fighting against it. The Trevor Project, I think, is perhaps the most public facing at this point. They are doing a lot of advocacy to raise awareness, bare minimum. There's also a number of faith-based organizations that are doing a lot of good work. These are organizations, whether it be at the church, sort of like congregational level, or I know that the LA Episcopal Diocese is going to be doing an event about conversion therapy, and the only reason I know that is because I'm the person who's doing the event. But so there are faith-based organizations out there. I mean, I have a list of folks that I've been partnering with. So I think that they're definitely an example, or those are two examples. Also, the American Bar Association They are fighting against conversion therapy. A lot of different state LGBTQ organizations are fighting. So, Garden State Equality in New Jersey, One Colorado in Colorado. These are different organizations that will also be doing this work. And so if you're looking for LGBTQ centers, or you're looking for legal organizations, these are some of and then also again, nonprofits like Trevor Project. These are some of the organizations that are really doing the work. But I would say that what I've noticed is that there's a lot of faith-based organizations, which I'm so darn grateful for. I think in part, it is the responsibility of these organizations. Why? Because under the umbrella of religion, specifically, in very particular denominations, that these are where these conversion practices are happening disproportionately. So I do think it's the responsibility of faith communities. But I do see a number of organizations sort of stepping up and doing this good work. And so I can send you a list of organizations I've partnered with later. And these are, again, a lot of the orgs that are doing are proactive in this. But I'd say Trevor Project is probably the biggest national organization at this point that's doing this work.
I will also note that PFLAG, as was noted in the chat, is out in front on this as well. And many members of our community are members of groups of professional associations, whether it's the American Psychological Association or the American Medical Association, National Association of Social Workers, on and on and on. Those groups, I think, also are starting to step up to be clear about their code of conducts and their ethical directives for their members. And we should be supporting them and, reinforcing how important this is to our community. What I would like to do at this point is stop the formal part of our program with great thanks to Lucas for being with us, being out there in front on this, to Joe for sharing his story as a member of our own community who is just one of so many people who have experienced this. If you have not yet picked up Trevor's book, Shame, Sex, Attraction, Survivor Stories, it's on my Kindle, so the cover disappeared. In recent Datelines, we have had a promotional code for that. You can go ahead and order the book. There is nothing like reading the stories of people who have experienced conversion therapies to understand what's involved in it and the tremendous impact that shame in particular, as well as all of the other consequences that were discussed tonight, have on people's life. It is not an easy book to read by any extent of the imagination, but it is important. And Lucas, like so many others, have done a great job in collecting the testimonials and allowing people to speak for themselves. Lucas has agreed to stay on for a few minutes if there are folks who would like to ask questions but didn't want to do that, while this was being recorded. We will be posting a link to this recording on our YouTube channels for folks who asked questions. We will check with you to make sure you're okay with your question being asked before we do that, just in case there are any privacy concerns at this point. But again, thank you so much to our presenters and to all of you for being here. This is kind of the beginning of the next phase of our work on this issue, not the end of the conversation here. So again, thanks to all of you for being here. And if you'd like to stay on and just chat more informally, the recording is off and you are welcome to do that.